It is important to obtain accurate, objective data from your patient. This is especially true in pediatrics, where children will subtly compensate until they no longer can and things go south fast. It is incredibly important that you know how to obtain vital signs accurately, because a deviation from normal vital signs in pediatrics raises a red flag that something may be wrong. Hi, I'm Anna. I'm a critical care register nurse who has a lot of experience taking care of really sick kids. Let's talk about some of the content we're going to be going over in this video. And I've provided timestamps for you in the description below so that you can jump around easily. The 5 vital signs that we are going to focus on obtaining are respiratory rate, heart rate, temperature, SpO2, and finally blood pressure. If you haven't seen my video yet on the general approach to the pediatric assessment, I would highly recommend that you start there, and I will link that video here. Respiratory rate is one of the most important vital signs in children because it can provide key information as to how much or how little their bodies are compensating. To accurately assess respiratory rate, count and listen to respirations for 1 full minute, because young children and infants have irregular breathing patterns. And remember, the younger the child, the higher the respiratory rate will be. When assessing a child's heart rate who is younger than 2 years old, auscultate the apical heart rate for 1 full minute. And remember, this is listening with your stethoscope directly on the child's chest where the pointed end of the heart is, the apex. You may switch to palpating the radial pulse for your heart rate when a child is 2 years old. And remember, just like respiratory rate, the younger a child is, the higher their heart rate will be. Temperature is frequently measured in degrees Celsius, with normothermia being between 36.5 and 37 degrees Celsius. A fever is considered 38 degrees Celsius and greater. Temperature can be obtained in children using temporal and axillary thermometers. Obtain an axillary temperature if the child is younger than 3 months old, and if they're older than that, a temporal thermometer is fine to use as a screening tool for a fever. In the hospital, we typically don't do rectal temperatures or use tympanic membrane thermometers that go in the patient's ear. The saturation of peripheral oxygen, or SpO2, is a measure of how much oxygen red blood cells are carrying throughout the body. Typically in children, we want this to be greater than 92%. However, there are some exceptions to this. An example of this would be a known cardiac patient with a congenital heart defect whose normal oxygen saturation is in the low 80s. This may be entirely appropriate for this patient, so make sure you look at your patient's orders to see what their target SpO2 range is. The final vital sign we'll focus on obtaining is blood pressure. While this is easier said than done, you need to obtain a blood pressure while the child is calm to prevent a falsely high blood pressure reading. Place the blood pressure cuff on an upper extremity and make sure that it is the appropriate size for your patient. A blood pressure cuff that is too small will cause an inappropriately high blood pressure reading, while a blood pressure cuff that is too large will cause an inappropriately low blood pressure reading. Quickly determining if a blood pressure is normal for a child requires further assessment. This is a helpful formula to use. Normal systolic blood pressure equals 70 plus a patient's age in years times 2. And remember, the systolic blood pressure is the top number of your blood pressure reading, and it represents how much pressure is on the artery walls each time the heart beats. Blood pressure also tends to increase with increasing height and weight, so a larger child will have a slightly higher blood pressure than a small child will. The last thing that I'll say about blood pressure is that it's typically one of the very last vital signs to change in a really sick child. So don't quickly dismiss a normal blood pressure in a child that otherwise presents as sick or that you're concerned about. A normal blood pressure with an abnormal heart rate or breathing could still be a warning sign for a potential clinical decline. I hope that you have learned something in this video, And more importantly, that you are more aware of the necessity of obtaining accurate vital signs so you can quickly determine if a finding raises a red flag and needs further assessment. If you found this video helpful, please feel free to share it. And of course, if you have any other questions about pediatric care or suggestions, please comment and let me know.